to understand the motion if you're able to do that. So today we're going to go over flexion, extension, abduction, internal rotation, and external rotation. The shoulder also does adduction, horizontal abduction, and horizontal adduction, but those ones we're not going to go over. All right, so shoulder range of motion, abduction and adduction. So this one we're just going to focus on abduction, which means we're taking the shoulder and making the angle bigger. So here, what's important for you guys to know is what a normal range of motion looks like. So for shoulder abduction, it's 170 to 180 degrees. So if we're lifting just the arms away from the body. Most people will be able to go all the way up. 180 is straight up. Adduction is when we're coming towards the body. So that's why we're not going to measure it, because we have a really big barrier for the rest of our body. We can't go any further. If we wanted to go further, we'd have to move the shoulder into a different plane. So therefore, we're not getting true abduction in this plane. The next one is flexion and extension. So these two, we will have to know both of them. So flexion, the normal range of motion, again, is 170 to 180. So this is if we're coming forward all the way up. So again, we're going all the way to our range, but this one is forward, so we're in a different anatomical plane for the body. Extension is going to be that same plane, but we're going to come back this way. And the normal range of motion for this is 50 to 60 degrees. These ranges of motion are going to be important when we get into the goniometry and when you guys are actually measuring the angles of these motions. All right, next is shoulder rotation. We have internal rotation and external rotation. So this one we're going to measure here, if our arms are here in our body. External rotation is this way, and internal rotation is this way. Normal ranges of motion, internal rotation is 80 to 90 degrees, and then external rotation is 90 to 100 degrees. Anybody have any questions on what those ranges of motion look like or what they do? We'll come back to the normal ranges when we do the goniometer and when we learn how to measure those. All right, so goniometry is a skill that you will need for most of the professions that exercise science has. Physical therapy uses it a lot. Athletic training uses it some. Strength and conditioning can use it if a person's not getting somewhere that they want to be in their weight training program. We use it to track progress. So in general, a goniometer is a measuring device used to measure range of motion. It measures the angle at each joint to give degrees of motion for that range. And it's used to measure in an initial evaluation, and then you can use it to track progress as that person is either getting better or getting stronger. There are 3 parts to a goniometer that are really important for you guys to know. Each range of motion will have a certain landmark that all of these go on. That's another reason why knowing those landmarks is really important. So the axis is this big middle part here, and this is what everything rotates off of. So this will be where you place your joint that you're measuring. It goes in the middle. The movement arm will go with the body part that is moving. And then the stationary arm will stay where you put it, and then as this one gets bigger, that's how you measure the motion that you're looking for. There are red and black numbers on here, so make sure that you're being aware of where you're starting. So if we start at 0 and I measure out this way, this here, I know this is a 90-degree angle, so if I'm looking at it and I'm reading 0, I know I'm reading the wrong number. I want to read the black number, which is 90. Does that make sense for everybody? All right, so now we're going to learn how to measure all of those 5 ranges of motion. What we're going to do is we'll learn a couple and then we'll practice them, and then we'll finish up with our learning task. So measuring shoulder abduction, again, as the picture shows, is the shoulder going out to this way as far as it can go. It's easiest if your patient is laying supine. Then you're not having to hold and balance your goniometer. You can kind of just place it on them and then measure as you go. So they will lay on their back with their arms at their sides. You will set the goniometer, and then they will abduct their shoulder to full range of motion. So I'll show you on this, guys, even though he's not laying down. Your axis is going to go anterior to the acromion process. So we'll find our acromion like we did earlier, and we'll place our axis right in the middle of that. Our movement arm is going to go with the shaft of the humerus, or the midline of the humerus here. And then our stationary arm is going to stay parallel to the torso. So this is what it should look like on our patient. And then he's going to abduct his arm this way. And then what I'm going to do is I'm going to follow it with my movement arm out this way. So on him, I can't do all of it because he can't move his arm. But what I'm going to do is as the patient moves their arm, I will follow with the movement arm until they can go as far as they can go. So right here is 170 degrees. So this starts our normal range. So if I'm looking at my goniometer, there's a lot of numbers on here. There's a red one, a black one, another red one, and another black one. But what I'm going to do is I'm going to think about our normal range, and am I in the right spectrum there? So if I'm reading 10, and I look at our normal range is 170, this one's not the right number. I want to come across the other way, and here I'm at 171, so this is closer to our normal range, so that's where I want to be. There are going to be people who fall in and out of this range, but we use this to know it, at least we're in the right ballpark. Measuring shoulder flexion. This one, again, is going to be 170 to 180. We're going to be on the side of our patient now. They'll be laying down on their back, arms at their sides, and then they're going to flex to their full range of motion. All right, so our axis is going to be lateral to the acromion process. So again, we come back, find our acromion process. Axis is going to be here. And then our stationary arm will stay parallel to the torso, and our movement arm is going to be centered over the midline of the humerus. So just like this on the side, and then as they fully extend, we will follow and go all the way up. This is about 188 right here. So I know that that's in my normal range, so I'm doing this correctly and looking at the right numbers. Any questions for that one, or how you would position your patient? If they don't know what flexion, extension, and those things mean, it's easiest if you just tell them, okay, I want you to move your shoulder like this, and if you demonstrate it for them, it'll help cue them easier. Measuring shoulder extension. So now we're going to be in the same place, except your patient's going to be laying on their stomach so that their arm can go the other way. Again, beginning with their arms at their sides, and then you instruct your patient to extend to their full range of motion. This one's a lot smaller. So here our range is 50 to 60 degrees, which is not very much. 50 is right there. And so we need to take that into account when we're measuring. So same placement for the goniometer. We're going to go lateral to the acromion process here. Our stationary arm is going to stay parallel with the torso, and then our movement arm is going to go lateral to the humerus. And then we'll instruct them to extend as much as they can, and then we'll follow them back this way. All right, so then here, again, looking at the right numbers, here is 40, but here is 140. So we want to make sure that we're reading the right number. All right, so then we have shoulder internal rotation, which is one of the harder ones to do. But thankfully, we do the same thing for internal rotation as we do for external rotation. So our patient will be laying on their back for this one, but we want their arm to be abducted to 90 degrees and then with elbow flexion. So they'll be laying down like this. we have abduction and shoulder or elbow flexion. So we're here. So then our goniometer will be centered over the olecranon process, which is the really bony part of your elbow. We didn't palpate that, but it's just the big point in your elbow. Your movement arm will be centered over the ulna, so down the arm, the forearm, and then your other one will be perpendicular to the floor. So you'll be here. This one's a little bit more tricky because we're reading a different number. So this one we want to look at the red number because that means we start at 0. And so that helps us because we have to start at this angle. We want to read the red number for this one. And so then you instruct them to internally rotate. So if they're here, internal is down. We learned it here. Now we're going to transfer it up to here. And we're going to go down for internal and up for external. So then external rotation, you'll keep your patient in the same position on the table, abducted to 90 and flexed to 90. Your goniometer will go in the same place, except this time you'll ask them to go into external rotation. This range is 90 to 100, so it's a little bit more than internal rotation. Again, keeping those ranges in mind when you're measuring. I'll come around while you guys are doing these. These ones are a little bit more complicated to do. And the goniometer is a little bit harder to read and interpret, so if you're getting the wrong number, please just raise your hand and I'll come over and ask and help you out. All right, so our second learning task is learning how to use a goniometer. Who can think of why this might be important for exercise science? And knowing how to correctly measure these angles. Mm-hmm.
If a person just had surgery on something and their range of motion is limited, you know what it's at, and then you know 2 weeks on if they're getting better or staying the same.
Yep, so a big thing with us is documentation. So then, like he was saying, if someone had surgery and I use this to measure where their knee range of motion is at one point, I can know where they started from right after surgery. We can do rehab for 2 weeks, and then I can remeasure and see the progress that they've made. That's exactly why we need to learn this. All right, I have goniometers up here. Break up into your groups again. I've listed down here the ones that you're supposed to measure. In your groups this time, I want you to think about what would fall within the normal range of motion. Does your partner fall in? Some people might not, and that's okay. But then I also want you to think about the end feels that we had when we were going. So think about which ones are spongy or bony or ligamentous, if you feel what those are. All right, I'll pass these out, get into your groups, and we'll talk about, I'll come through and talk about and ask questions if you need them. It could be both. So that could be like a bony disposition, or you could just be really flexible. For the most part, it's going to be the muscle is bigger, or like your joint is a little bit looser. It can, yes. Like some people, they're born that way. Some people are adapted that way, depending on their sport or lifestyle, injury, things like that. Oh, yeah. If you guys need me to go back through any of the slides, please just let me know. sudden, if they are more than 180, they get that full range of motion. Yes, yep. Because then there's no barriers, and it kind of stabilizes their whole body, so they're not like coming off the table to try and cheat and get a little bit more. Which one are you doing here? So you'll be more like on it. You'll be more like on top. So this one you want to just kind of eyeball the chromium process, parallel with the torso, and then follow out that way.
Oh wait, no.
Same way as
That was too like. I like put it here, and then she's like.
Yeah, because then you hit it, and it's kind of, it doesn't fit. Yeah.
I feel like I'm doing that game, like one hot dog or whatever. What? No, where you flip it over. Yeah. There, there's the game. Giving it time. You're understanding. You roll over. That is stuck on it.
Make sense? Yeah. So for this one, we want the stationary to be for there you go. Yep.
But it's the one that starts at 9.
This is, we're going to read the red number, so that's 0.
Okay.
So she'll start abstracted and flex to 90. So we'll start
Anybody know the normal ranges for internal rotation?
and then we'll internally